Lumbar spondylosis, lumbar arthritis, two super common problems. They're the same thing actually. Spondylosis and osteoarthritis mean the same thing. Essentially what they do mean is that when your vertebrae once were like that, which is smooth with a padded thick disc, what osteoarthritis is typically creates, I should say, is a rounding off or a irregularity in the bone shape and a squashing and a compression of the disc. Now, in the second example where the spine has osteoarthritis or spondylosis, it's really common to have a lot of stiffness in the spine, and it's also really common to have pain in the lower back, an ache or pain, and or sciatica or leg pain. So spondylosis of the lower spine, sometimes there's a genetic component, so sometimes you can be a little bit unlucky and have a predisposition to this, but the vast majority of the causes of lumbar spondylosis is actually lifestyle, and specifically long periods of inadequate movement through the spine. When the spinal joints don't hinge and pivot frequently like that, they get rather stuck and jammed, that's what creates the changes in the disc, and the disc starts to dehydrate. It doesn't receive adequate nutritional supply, and therefore it starts to break down and dehydrate, thin, become brittle, and become much more susceptible to having a significant disc injury. So long periods of immobility through the deep joints is what promotes or accelerates osteoarthritis, whether it's in your genes or not. So really what I want to cover with you today is 3 amazing stretches that you can incorporate into your life with no equipment. No equipment, all you need is the knowledge, some floor space, and you can get into doing these on a very regular basis. And I guarantee you they will provide greater flexibility and pain relief if you are suffering with lower back pain from whatever cause, but specifically if you know that you have some osteoarthritis or degenerative change in the lower spine. So watch on as I just cover these simple 3 exercises, and I do hope that these give you the information that you can incorporate into your life on a regular basis to help yourself. After all, no one is more motivated to help than you are to help yourself. So these will equip you with that information. Watch on as I demonstrate these 3 videos for you now, or these 3 stretches, I should say, for you now to incorporate. The first stretch to show you to help with lumbar degeneration or spondylosis is called child's pose. It's a deep, long stretch of the lumbar spine. It's just like this. So what you want to do is just kneel down with your backside on your heels, and then create a little gap between your knees and then stretch forward. I'm stretching forward, and as I stretch further forward, I'm also pushing my backside further backwards. So my hands are forward, my backside's backwards. It's elongating my body. And in this position, you will feel the stretch as you hold the stretch. This is a stretch designed to be held for 1 minute minimum up towards 2 minutes. The longer you hold the stretch, the more you will feel your body opening and stretching. You'll even find as you hold the stretch that your backside elongates further backwards or drops further to the ground the longer you stretch it. So it's designed to be for 1 minute minimum up towards 2 minutes, and ideally you want to do this stretch 3 times when you're going through the stretch. So 3 times for up to 2 minutes, so up to 6 minutes of doing this stretch to elongate that lower back and relieve some of that stiffness, tension and pain in that area. The second stretch, this is a great stretch for the really tight muscles that are through that lower glute area. It's like this. You lie onto your back with bent knees, and you want to lift up one leg and you want to pull that knee towards your opposite shoulder. So I'm pulling it up and across. And as I'm pulling it up and across, I can feel a deep stretch coming all through here. You can play with the angle slightly. You could pull it slightly towards your head, slightly towards your shoulder. You can play with the angle or slightly further across your body. You can play with the angle to get into the different fibers of the glute area. This stretch, it's about a 30-second stretch, 30 seconds, and then repeat the side, or change the side and repeat the stretch. So whatever you do with this stretch, do it on both sides. So 30 seconds the other side, changing the angle as you go. And repeat that 3 times each side. So that's the second stretch. The second stretch is the glute stretch. The first stretch was the child's pose stretch. The third stretch, which is a deep rotation of the lower back. You lie onto your back, and in this position, you bend the knee and let it, you let your body slightly twist, and then use your opposite hand, right hand, left leg, to pull across and stretch. And you can also reach your left arm out. So left leg can come this way and left arm can go that way. Deep stretch all through here. I'll demonstrate it the other direction so you can see. So this time it's right knee bent, left hand pulling across, and a deep stretch coming all through this area through here. Once again, this stretch, it's best to do for 30 seconds each side, and to do each side 3 times. And you'll feel a deep stretch coming all through this lower back up into the upper part of the lower back. So just summarizing back to you those stretches, that's a child's pose stretch. The child's pose is a 1 to 2 minutes, 3 times. The second one was the gluteal stretch. Bent knee to opposite shoulder, 30 seconds, 3 times each side. And the third one, which was the lumbar rotation, which was bent knee rotating it across, 30 seconds each side, repeat it 3 times. If you start to do these stretches, I'm confident that they'll provide some significant flexibility improvements plus pain relief. So start to incorporate them, they're safe to do. So wherever you are, I hope this video has been of some use to you. I hope actually that you don't need to do these stretches because of pain, and that you just want to do them to help with flexibility. But if you are suffering with pain, you do have any questions, please comment, and I'll do my best to answer them in a way that is productive and useful to you. So wherever you are, I hope you're enjoying great health and that you aren't actually afflicted by lower back pain. But if you are afflicted with lower back pain and spondylosis or degeneration, then I hope this information will be of use to you and start you on the way forward. Thank you for watching.